Lake Alice is one of this country's darkest chapters of abuse in state care, as we've heard. Testimonies of people given massive doses of medication and electroconvulsive therapy, injections of antipsychotic drugs, seclusion, being stripped and being locked in a small room, chained to chairs, other forms of punishment. Fortunately, these types of therapies are not part of current practice and certainly not part of any religious organisation. So if this bill is about banning practices which are coercive, abusive or involuntary, or include ECT or any of the things that I've just listed, which is the imagery and understanding that many people have when they hear the term conversion therapy, then we all agree that such things are inhumane and must be condemned. And they rightly have been, which is good. But here's the issue. There is no evidence that abusive or involuntary practices are still occurring in New Zealand under the name of conversion therapy. And don't believe me, even the Ministry of Justice's regulatory impact statement all but admits that, and I'll come back to that. The Human Rights Commission has admitted that there's only been one informal complaint in the past 10 years in relation to conversion therapy. No evidence of complaints to the Office of the Health and Disability Commissioner. But conversion therapy has now expanded to mean stopping someone who experiences unwanted sexuality issues or gender dysphoria from getting counselling or support of any sort that they themselves may desire. So while there's rightly support for getting rid of the Lake Alice type abuse, when people truly understand what this bill is about, their view quickly changes, as we saw with the Minister of Justice's interview and comments around puberty blockers for 12-year-olds in the subsequent fallout. And I draw your attention to Appendix C of our written submission, which is the independent nationwide poll at the end of last year on the effects of this bill. 81% of respondents said they believe the person should be able to seek counselling support to determine their own direction about their sexual orientation or gender identity. When they were asked if a child is confused about their gender, should it be a crime for a parent to affirm to their daughter that she's a girl or to their son that he's a boy, 81% were opposed to it being criminalised. And the question, should it be a crime for a faith leader to teach a biblical or Quran view of sexuality and of gender being determined at birth, 62% said it shouldn't be a crime. Now, contrary to some of the narrative by supporters of this bill, parents could be criminalised for rightly wanting to protect their children from the physical, emotional and physical harm caused by gender dysphoria. The Ministry of Justice's own analysis of the proposed law admits this. It says, quote, interactions within a family would also be captured if they meet the definition of conversion practices, end quote. Crown law also refers to this chilling effect. As Minister of Justice Chris Farfoy and the Prime Minister have admitted in media interviews, a parent who promotes biological sex could be criminalised, but an activist who indoctrinates young children with the concept of gender fluidity and third gender will be celebrated. And this can and currently does happen in some schools without parental knowledge. And we cover this in detail in our written submission, paragraphs 62 onwards. It's a form of conversion therapy happening in our schools. Now, numerous reviews show the majority of children who are confused about their gender can also suffer from comorbid disorders such as depression and anxiety. And studies also show that anywhere from 75% to 98% of children who struggle with their sex as a boy or a girl come to accept their sex by adulthood. Now, I hear the claim made, oh, but the Attorney General has to approve any prosecution. It's a high bar, it's very unlikely that parents will get prosecuted. Well, that statement overlooks a fundamental issue, and that is the proposed legislation is criminalising conduct that should not be criminalised. And the New Zealand Law Society also rightly points out in their submission that the Attorney General's consent doesn't apply to complaints laid to the Human Rights Commission, and proceedings will be taken before the Human Rights Tribunal. Actually, I was interested in the New Zealand Law Society submission because it made quite a few significant statements. It criticises the law for, quote, not giving a reasonably clear description of exactly what conduct is prohibited, end quote. It rightly says, quote, there is no definition of gender identity in this legislation or any other New Zealand legislation, end quote. And they also say, quote, omissions to provide assistance, acceptance, support and understanding could count as a conversion practice in some context. That's omissions. So that's contrary to some claims being made from non-legal people. In 2019, this committee, your committee, declined to support such a ban. They said the Bill of Rights Act protects those who offer and seek out conversion therapy because of their religious views. And a year before, the Associate Minister of Health was advised by the Ministry of Health, quote, "It is not recommended that a legislative ban of conversion therapy would be the most effective way to reduce the harm it causes." Here's the contradiction of this proposed law, though. One-on-one counselling to help a teen struggling with body image due to anorexia would be permitted. A parent encouraging them to accept their body and deterring or preventing them from starving and harming themselves, that's okay and legal. But the very same counselling would be prohibited if the goal is to help a teen struggling with body image again, but this time due to gender dysphoria and confusion. And incredibly, the bill says that consent is irrelevant. Now, this will constitute a serious interference with the rights and freedoms and a family's legitimate expression of opinion affirmed in the Bill of Rights Act. I want to direct you to two legal opinions which are in our written submission. The first is from Grant Illingworth QC in Appendix A. Page 23, he says, quote, "At the root of many rights and freedoms affirmed by the Bill of Rights Act is the ability of individuals to decide their own destiny without interference from the state." And he talks about parents who tell their children that they cannot go on puberty blockers or wear chest binders or identify as the opposite sex. And he says, quote, "The definition of conversion practice is a debatable issue, but if providing parental guidance is a practice, then the conduct outlined above would fall within the proposed restrictions and would be a criminal offence." And of course, the New Zealand Law Society also referred to this concern around the definition of conversion practice. The opinion also says, page 22, there is a risk of serious disruption within religious communities, including Muslim and Christian faiths, which will be significant and substantial. And he refers to if a person wants to align their sexuality or gender with the teachings and values of their faith and personally sought help, quote, "the person would be inviting the teacher, counsellor, or church pastor to engage in a conversion practice which would be criminal in some circumstances." And just finally, on page 20, the opinion notes, quote, "It is worth recalling that one of the stated purposes of the proposed legislation is to promote respectful and open discussions regarding sexuality and gender. The idea that the proposed legislation would promote respectful and open discussions regarding sexuality is therefore difficult to accept." I also direct you to Appendix B, which is page 24 onwards of the written submission. It's a legal analysis from Patrick Parkinson, who is an Australian expert on family law and child protection, 35 years experience, professor of law at the University of Queensland. His executive summary is paragraphs 2 to 5, but I especially point you to paragraph 4. He says, quote, "The bill creates a draconian offence. Some mental health professionals will refuse to see young patients with sexual orientation or gender identity issues who have other serious mental health concerns. This could lead to an increase in the mental health burden on already very troubled young people and may lead to increased suicide attempts." And also paragraph 5, quote, "Parents who act upon expert medical advice in helping their children with gender identity issues risk prosecution under the law as defined." And interestingly enough, I heard the Young Nats doing their oral submission yesterday, and they too alluded to concerns around prosecuting parents and the definition of suppressing and what does that mean. The regulatory impact statement is important from the Ministry of Justice. It acknowledges that prayer, counselling, family discussions, parenting advice will be caught. Crown Law also alludes to this in their advice to the Attorney General, paragraph 3. The regulatory impact statement admits a number of times that there is little evidence of conversion therapy actually happening in New Zealand. It uses phrases like lack of baseline data, limited data, no reliable data. It is very reliant on apparently just media reports. And the problem is that there is no acknowledgement from the ministry that some people personally and willingly desire and choose change in their sexuality and their gender dysphoria. And there are many other people highlighted on our website, freetolive.nz, but who the media won't give a voice to. And there are also many within the LGBT movement who are also concerned. They too oppose puberty blockers, chest binders, cross-sex hormones, and surgery for young teens as a loving solution to gender dysphoria. Just finally, we have a copy of a research report, Free to Change, which has collected the real life stories of 78 ex-LGBT people who are able to live comfortably with their birth gender and or have resolved sexuality issues. And these people say that they are happy that they made change and were grateful that they had therapy and counselling, both secular and religious counselling. And these stories show that these therapies resulted in marked improvements in their mental health and marked reductions in suicide risk. Advocates for conversion therapy bans often point to the La Trobe University report, which relied on the testimony of just 15 individuals. But there are many more testimonies of change, including New Zealanders, on the freetolive.nz website. And people can and do want to change, but the media won't tell you these stories. And this bill will criminalise these choices. So just in conclusion, under this proposed ban, people will be prevented from getting help to live the lifestyle they choose. And children could not be encouraged to embrace their biological sex. While gender and sexuality is supposedly fluid, activists want the law to stipulate that it can only go in one direction that they approve. And for all those reasons, we oppose the bill.